Cortisol is essential throughout the body, thus its management is crucial for overall health and well-being. Hypercortisolism, also known as Cushing syndrome, occurs when there is prolonged exposure to overproduced cortisol. There are several screening tests that have been used to diagnose hypercortisolism. However, we will focus on the three most often used in practice. The overnight dexamethasone suppression test, or DST, assesses responsiveness of the HPA axis. A 1 mg dexamethasone tablet is taken between 11 p.m. and midnight, followed by a blood sample collection in the morning to measure serum cortisol levels. DST detects autonomous cortisol secretion and is the preferred test for patients with adrenal adenoma. However, certain drugs can influence test results, leading to false positives and false negatives. And there are special recommendations for certain patient populations. Late-night salivary cortisol test, or LNSC, measures the concentration of cortisol in the saliva, when cortisol should be at its lowest level. The LNSC test is simple to perform. Patients are instructed to collect their saliva between 11 p.m. and midnight. The LNSC detects the loss of diurnal rhythm and is the most sensitive for detecting Cushing disease reoccurrence. However, this test requires multiple sample collections, and many factors may influence the result. The Urinary-Free Cortisol test, or UFC, measures unbound cortisol in the urine. A patient collects urine over a 24-hour period. The UFC detects the gross overproduction of cortisol. A UFC value that exceeds the upper limit of normal may indicate hypercortisolism. Up to 3 UFC tests should be performed to confirm results. Patients with renal dysfunction could produce false negative results, and high fluid intake may result in false positive results. An individualized approach is recommended when determining the various appropriate tests, the number of times to repeat, and results need to be analyzed properly. Early recognition and screening of hypercortisolism can prevent the long-term consequences of Cushing syndrome and reduce mortality rates.